Hi, welcome to my presentation. Today I will be discussing medication errors and more specifically reducing preparation and administration distractions experienced by the RN. 450,000 adverse medication reactions events happen annually in the United States. $3.5 billion is spent yearly on such events in the United States alone. These staggering numbers need to be reduced, and nurses have the power to do so. Stated objectives will be covered during the presentation. It is my hope to open your eyes and bring an awareness to this issue and a knowledge of understanding of the problem and what simple interventions can be. The purpose of the pretest is to measure knowledge of this issue before the presentation. Please take note of the questions as they will be each addressed during the presentation, and a post-test will follow as well. This is the research. This slide indicates the research method that I used. I conducted a systematic review of literature. It consisted of studies of nurses who prep and administer medications in hospitals or in inpatient settings. All literature reviewed was current with the oldest studies from 2014. This slide is a comparison of deaths annually from common causes compared to the amount of deaths from adverse medication events annually. It depicts how staggering the problem is. 251,000 deaths occur annually from medication errors as represented by the bar graph to the left. 285,000 deaths occur annually from all cancers combined as represented by the bar graph in the middle. 611,000 deaths occur annually from cardiovascular disease as indicated by the bar graph to the far right. This slide represents some of the evidence-based research, some of the results I found. The research that I did had identified the most frequent distractions and interruptions experienced by nurses during med prep and administration. The results of the surveys I also conducted with the floor nurses revealed the same information. I'm sure we can all relate to these distractions and can agree they disrupt the flow of med prep and administration, to say the least. I know for me, most often it's phone calls that are that interrupt us the most. Now, also found in my evidence-based research, the literature revealed that there are simple solutions. As this slide shows examples, this is what I propose as the simple and inexpensive interventions to this staggering problem. Safety vests will be worn by the RN during med prep and administration, as illustrated in this slide, and they will say something to the same effect as, do not disturb med administration in progress. Also, signs will be placed in med prep area. Literature has proven that safety vests and signage in prep areas reduce nurse distractions and reduce adverse medication events. Please note that one study found that medication adverse events decreased a whopping 66% and nurse interruptions decreased 75% when safety vests were worn by the RN. Yet another study found an 88% decrease in merit errors after the safety vests had been worn. Medication variance reporting systems, similar to the event reporting system used here, identified an 88% decrease in med errors after the use of safety vests were worn by the RN, further proving the point. The post-test questions. Here is the post-test, which is the same as the pre-test. Hopefully, the presentation has made enough of an impact so that you can easily answer the questions. In conclusion, nurses can make the biggest impact in reducing the amount of adverse medication events. The evidence based research that I have discussed makes clear that the simple and inexpensive use of safety vests and signage directly impacts and reduces the number of adverse medication events. It will take all nurses to be on board and embrace the proposed changes to achieve a smooth transition and ultimately a reduction of adverse medication events. Thank you for your time.